When I was looking for residency programs, I tried to go very methodical about it. I had my 3 Ps that I call them: the patient population that I would have the privilege from learning from. Second was the people who work there. And the third was the place. The magic of Mayo Clinic captured me, and here we are. It checked all 3 boxes for me.
So I came here on interview day. We do in-person interviews usually, and like I said, I just got like the warm fuzzies right away. You know, you walk in the door, you feel the energy. Everybody's like happy to be there. Everybody wants to be part of a team. It's all about that collaborative learning environment. How are we gonna do better today than we did yesterday, but without that like competitive nature? It wasn't just the interview day like magic, right? But it's just the magic of Mayo and being here in this residency program.
It's always an exciting time to be in emergency medicine. I want to take somebody who's interested in emergency medicine, wants to be the best that they can be in their field, wants to be a leader in their field, and I want to help them achieve that. You will graduate from this program as an excellent emergency physician.
Mayo's mission is to train individuals to practice in any environment to provide the highest level of care to any patient that walks through that door.
When we're interviewing for residents, that's often a question that they ask me is what's so great about Mayo Clinic? And I think it's that ability to define and redefine yourself. There are so many different things to pursue and so much support to take any given track that interests you and have resources and, again, support from the program and leadership to go after what you're interested in.
We have an enormous amount of elective and selective experiences that you can choose from, and you can choose whatever is going to help you maximize your strengths, build upon your weaknesses, and prepare you for the future practice environment that you're facing.
So with the 4-year program, I get to do things like the McShaka rotation, which is the child abuse rotation, just because that's an interest of mine and something that I want to be better at. I'm going to do like some critical care rotations. I'm going to do some community rotations, and you wouldn't get to do that in a program that's only 3 years.
I love education, all aspects of it, as well as global health. So I want to intermarry those 2 concepts together so we could do a lot of emergency medicine education abroad, specifically in countries that don't have emergency medicine already established or are in the process of establishing emergency medicine as a specialty.
What we offer is a different experience focused on efficient, effective care for acutely ill patients who are complex and serious. And in the current environment, with emergency medicine being highly competitive for jobs, having additional skills in either quality, education, or research, and even practice will pay dividends for your career.
One of the absolute best parts of my job is I can watch somebody come in intern year and they're not super confident, they're a little timid, they're not sure what they're doing. And over the course of 4 years, all of a sudden they've become this incredible clinician. They are making decisions, they have astute skills, and it's just amazing to look back at the person they were when they got here and how they've grown and changed and become a wonderful provider.
Emergency medicine is evolving, and emergency medicine is constantly changing. And residents who choose to come and train in this program get to interact with individuals in not just our specialty, but all of the specialties under the House of Medicine here at Mayo Clinic, all of whom really have the needs of the patient at the forefront, and just really a collaborative spirit that our residents get to take part in.
You can turn right or left and you will find a world expert in something here at Mayo. So it opens a lot of opportunities for you to pursue whatever you want to pursue. And it is also okay not to know what you want to pursue at the beginning of residency. And Mayo does a very good job of kind of figuring out what you will need or setting you up with a support system that helps you figure out what you will need.
We want you to leave your training feeling confident in procedures and in decision making. Because what drives us as educators is being able to dream about how we can optimize your Mayo journey, how we can make this the best training experience for you.